Stale coffee, dark humor, and a rigid, unforgiving hierarchy fueled the night shift. When Dr. Trent cornered a slouching triage nurse in the sterile supply room, he thought he was crushing a tired nobody. He didn't know her faded scrubs hid scars from Kandahar. He was about to find out. St. Jude's Memorial Hospital at 3 a.m. was less a place of healing and more a holding pen for the city's collateral damage. The fluorescent lights emitted a low mechanical hum that gnawed at the base of your skull. The air smelled of industrial bleach copper and the distinct sour sweat of people having the worst night of their lives. Sarah Jenkins fit perfectly into the background of this misery. She was 34, but the harsh overhead lighting and the permanent bruised-looking bags under her eyes made her look a decade older. She wore hospital-issued scrubs, 2 sizes too big, the fabric washed so many times it had lost its original teal hue, settling into a dull, anonymous grey. She didn't wear makeup. She kept her hair pulled back into a severe utilitarian bun. To the rest of the staff, Sarah was part of the furniture. She was the nurse you gave the worst jobs to because she never complained. Bedpan duty for the combative drunk in Bay 4. Give it to Jenkins, cleaning up the aftermath of a violent gastrointestinal bleed Jenkins. She didn't gossip at the nurses' station. She didn't flirt with the EMTs. She just clocked in, kept her head down, and absorbed the relentless misery of the ward like a sponge. To Dr. Trent and Nurse Jessica, she was a walking target. Trent was a third-year resident. He was tall, heavily gelled, and carried himself with the unearned arrogance of a man whose father paid for medical school. He treated the ER like a stepping stone, a gritty inconvenience on his path to a lucrative plastic surgery fellowship. Patients weren't people. They were charter numbers and annoying liabilities. Jessica was the charge nurse on the night shift. She had sharp acrylic nails, a sharp tongue, and a desperate need to feel superior to the people around her. She latched onto Trent's authority, acting as his enforcer. Together, they made the shift a living hell for anyone who didn't kiss their rings. Sarah, with her absolute lack of reaction, infuriated them. Jenkins, Trent, barked, slapping a metal clipboard down on the counter right over Sarah's charting. Bay 6 is a disaster. The OD patient threw up again. Get a mop and clean it up before my rounds. I can't think in that stench. Sarah didn't look up immediately. She finished logging the vitals of her previous patient, the pen, moving in slow, deliberate strokes. Then she capped the pen, set it down, and met Trent's eyes. Her expression was entirely blank. "Housekeeping handles biohazards, Doctor," she said. Her voice was flat, carrying a slight rasp. Jessica, leaning against the counter next to Trent, scoffed. "Housekeeping is backed up in the ICU, Sarah. Do your job. Or are you too tired? You look like you haven't slept since Thursday." Sarah looked from Jessica to Trent. She didn't feel anger. Anger was an expensive emotion. It spiked your heart rate, narrowed your field of vision, and impaired judgment. She had learned a long time ago to strip anger out of her nervous system entirely. She just felt a profound, exhausting boredom. She picked up the clipboard, handed it back to Trent, and walked toward Bay 6 without another word. "Unbelievable," Trent muttered loudly enough for her to hear. "She's a zombie. I don't know why administration keeps these burnt-out husks on the floor. It's a liability." Sarah walked down the corridor, her footsteps entirely silent on the linoleum. She didn't walk like the other nurses who rushed and slammed their heels down in a perpetual state of panic. Sarah moved with a gliding economy of motion. Every step was calculated. She kept her weight on the balls of her feet, her eyes naturally scanning the hands and waistbands of the people in the waiting area. It was a habit she couldn't break. Inside Bay 6, the patient was thrashing against his restraints, screaming obscenities. He was a large man high on something synthetic, his eyes rolling back in his head. Sarah didn't call for security. She approached the bed. The man swung a heavy restrained arm toward her face. She didn't flinch. She simply tilted her head 2 inches to the left. The fist grazed the air where her jaw had been a fraction of a second before. With a casual, almost lazy movement, she placed her thumb in the notch just below the man's jawline and applied 3 pounds of targeted pressure. The man gasped. His eyes flew open, the violent thrashing instantly short-circuiting into rigid paralysis. "Breathe," Sarah said softly, her voice barely a whisper. "Just breathe. The nausea will pass." She held the pressure point for exactly 5 seconds, then released it. The man slumped back onto the mattress, panting, the fight completely drained out of him. Sarah grabbed a wet towel, methodically wiped the vomit from his chin, and adjusted his IV line. She did it with the clinical detachment of a mechanic tightening a bolt. Civilian life was loud, messy, and fundamentally chaotic. Sarah endured it because it was the only way to blend in. The alternative was remembering. If she stopped moving, if she let herself care too much about the petty politics of St. Jude's ER, she would be back in the dust. She would smell the cordite. She would feel the slick, hot blood of Chief Petty Officer Miller slipping through her fingers while she desperately packed his femoral artery in the back of a shaking Black Hawk helicopter. Trent and Jessica thought she was weak. They mistook her silence for submission. They didn't understand that Sarah Jenkins wasn't retreating from them. She was granting them mercy. The trauma alarms blared at 4:15 a.m. It was a jarring, 2-tone shriek that cut through the low hum of the ER, instantly ratcheting up the blood pressure of everyone in the building. "Mass casualty incoming." The overhead speaker crackled. "Multi-vehicle collision on Interstate 95. 3 critical. ETA 2 minutes. The lethargy of the night shift vanished. Nurses rushed to prep the trauma bays. Jessica began shouting orders, pointing people toward crash carts. Trent tightened the drawstrings on his scrub pants, a nervous sweat suddenly breaking out across his forehead. He liked the idea of being a doctor, but he hated the messy reality of trauma. He lacked the nerve for it. Sarah simply snapped on a fresh pair of nitrile gloves. Her heart rate remained steady at 60 beats per minute. Chaos was her native language. The double doors banged open. Paramedics flooded the hall, pushing gurneys loaded with broken bodies. The noise was deafening shouts for blood types, the rhythmic pumping of ambu bags, the agonized groans of the conscious. "Alarm. Trauma 1, a paramedic yelled. 22-year-old male driver, crushed against the steering wheel. BP is tanking 70/40, diminished breath sounds on the right side. "Bring him in!" Jessica yelled, waving them into the main resuscitation bay. Trent stepped up to the head of the bed as they transferred the young man. The patient was pale, his lips turning a terrifying shade of blue. His chest was heaving, but only the left side was rising. "Tension pneumothorax," Trent said, his voice cracking slightly. His right lung collapsed. The air is trapping in his chest cavity and crushing his heart. "I need a needle 14 gauge. Now." Jessica tore open a package and handed him the long needle. Trent looked at the man's chest. It was covered in blood sweat and bruising from the seatbelt. Trent's hand hovered over the ribs. He was shaking. It was a simple decompression procedure, something they practiced on dummies 100 times, but the dummies didn't bleed. The dummies didn't look at you with wide, terrified eyes. "Doctor, his pressure is dropping, 60/30, the respiratory therapist warned. "I know!" Trent snapped, panic bleeding into his tone. He pressed the tip of the needle against the skin, but he hesitated. He was too low. He was aiming for the 5th intercostal space, but his trembling hand had drifted down toward the liver. Sarah was standing at the foot of the bed, holding a bag of saline. She saw the angle of the needle. She saw Trent's panic. If he pushes that needle in now, she thought, he's going to pierce the hepatic vein. The kid will bleed out in 3 minutes. Trent took a breath and pushed. A hand closed over his wrist. It wasn't a gentle tap. It was a vice grip of solid bone and tendon. The sudden immense pressure paralyzed Trent's arm entirely. He gasped, looking down. Sarah's fingers were clamped around his wrist. Her grey eyes were locked onto his. The blank, exhausted look was gone, replaced by a terrifying, absolute focus. "You're off your mark, Doctor," Sarah said. Her voice was quiet, but it cut through the screaming chaos of the trauma bay like a razor blade. "Second intercostal space, mid-clavicular line. You're over the liver." "Let go of me, Jenkins," Trent hissed, trying to jerk his arm away. Sarah didn't budge. She simply squeezed harder. Trent felt the bones in his wrist grind together. A sharp spike of pain shot up to his elbow. He dropped the needle. "Move," Sarah commanded. She didn't wait for him to step aside. She stepped into his space, driving her shoulder into his chest, forcing him to stumble backward away from the table. In one fluid, unbroken motion, she caught the falling needle with her left hand, snatched an iodine swab with her right, wiped a streak across the patient's upper chest, and plunged the needle into the correct space. There was a loud hiss of escaping air, like a tire deflating. Instantly, the young man's right chest sank. His eyes fluttered. "Pressure is rebounding," the monitor tech called out, relief flooding his voice. 90 over 60 and climbing. Heart rate stabilizing. The room exhaled. The immediate crisis was over. Trent stood against the back wall, his face flushed dark crimson. He looked at his wrist, then up at Sarah. She was already stepping back into the shadows, tossing the bloody wrappers into the biohazard bin, her face entirely blank once more. Jessica stood frozen by the crash cart, her mouth slightly open, having witnessed the entire humiliation. Trent's fear instantly rapidly mutated into a blinding, toxic rage. A nurse, the worst, most pathetic nurse on the floor, had just physically assaulted him and shown him up in front of the entire trauma team. The shift dragged on for another 2 hours. By 6:15 a.m., the rush had cleared. The sun was threatening to rise, casting a miserable grey light through the small, frosted windows of the staff break room. Sarah grabbed her battered canvas duffel bag from her locker. Her shift was over. She just wanted to go to her empty apartment, sit in the dark, and drink a glass of tap water. She took the back hallway toward the employee exit. It was a long concrete corridor that led past the loading docks and the medical waste disposal rooms. It was poorly lit, smelling strongly of ammonia and rotting cardboard. There were no cameras down here. She heard the footsteps behind her before she saw them. 2 sets, one heavy wearing hard-soled shoes, one lighter wearing squeaky clogs. Trent and Jessica. Sarah didn't speed up. She kept her measured pace. "Hey, Jenkins!" Trent called out. His voice echoed off the concrete. Sarah stopped. She slowly turned around, dropping her duffel bag to the floor with a soft thud. Trent marched up to her, closing the distance until he was inches from her face. Jessica flanked him, crossing her arms, a nasty smirk playing on her lips. "You think you're pretty smart, don't you?" Trent sneered, his breath smelling of stale coffee and mints. "You think you can lay hands on an attending physician? You're a resident," Sarah corrected quietly. "And you were going to kill that boy." "Shut your mouth!" Trent snapped, his voice echoing loudly. He stepped closer, attempting to use his height to intimidate her. He brought a finger up, pointing it directly into her face. "I am going to end your career. I'm going to the hospital board the second they open. I'm going to have your nursing license revoked, and then I'm going to have you arrested for assault. You're trash, Jenkins. You're a burnt-out piece of trash who got lucky," Jessica chimed in. "You should have seen yourself, Sarah. Acting like some hero. You're unstable. We've all seen it. You belong in a psych ward, not a hospital." Trent, fueled by Jessica's backing and his own bruised ego, made a critical mistake. He reached out and shoved Sarah hard in the center of her chest. "Look at me when I'm talking to you, bitch!" Sarah stumbled back half a step. She didn't say anything. She didn't cry out. She didn't look scared. Instead, she closed her eyes for exactly 1 second. When she opened them, the tired, slumping triage nurse was dead. Trent watched a sudden, cold prickle of unease crawling up the back of his neck as the woman in front of him physically transformed. The slouch vanished. Her spine snapped into perfect, rigid alignment. Her shoulders squared. Her breathing, which had been shallow and tired, dropped into a slow, rhythmic abdominal cadence. She looked at Trent. She wasn't looking at his eyes. She was looking at his throat, his knees, the carotid artery pulsing nervously under his jaw. She was looking at him the way a butcher looks at a side of beef. "Trent," Sarah said. Her voice had dropped an octave. It no longer sounded like a tired nurse. It sounded like a piece of heavy machinery grinding into gear. "Remove your hand from my space. Now." Trent swallowed hard, but his pride wouldn't let him back down in front of Jessica. "Or what, you're going to hit me? Do it. Give me a reason to have you thrown in a cell right now." He shoved her again. This time Sarah didn't stumble. Trent's hand lashed out palm flat, aimed squarely at Sarah's collarbone to push her backward. He put his shoulder into it. He wanted to see her hit the cinder block wall. The shove never landed. It wasn't a block. A block implies defense, a reaction to an attack. Sarah didn't react. She preempted. She stepped inside his arc of motion, cutting the distance between them to 0. Her left hand shot up the blade of her wrist, striking the inside of Trent's forearm, violently redirecting his momentum past her shoulder. Trent stumbled forward, thrown completely off balance by his own wasted kinetic energy. Before he could catch himself, Sarah's right hand clamped onto his triceps, her fingers digging viciously into the bundle of nerves resting against the humerus bone. She pivoted her hips, dropping her center of gravity. With a sharp, economical twist of her torso, she yanked his arm downward while sweeping her right leg behind his lead knee. The human body is structurally precarious. Once the center of gravity extends past the base of support, gravity does the rest of the work. Trent went down, hard. He didn't fall gracefully. He slammed into the concrete floor face first, his breath leaving his lungs in a sharp, wet cough. The impact echoed off the dirty walls of the loading corridor. The transition from arrogant doctor to a man eating floor dust took exactly 1.4 seconds. He gasped, tasting copper and dirt instinct driving him to scramble back to his feet. He threw his left arm out to push up. Sarah dropped her full body weight onto him. Her knee connected with the space between his shoulder blades, pinning him flat against the concrete. Simultaneously, she wrenched his right arm behind his back, locking his wrist against her hip. She applied 3 pounds of upward pressure to his elbow joint. The joint locked with a sickening audible pop. Trent let out a high, thin scream, a sound entirely devoid of the bravado he had wielded seconds ago. The pain was blinding, a hot spike, driven directly into his shoulder socket. "Stop!" Jessica shrieked, backing away until she hit the wall. Her sharp acrylic nails dug into her scrub top. "Oh my God, stop, I'm calling security, you're insane!" She fumbled for the phone in her pocket, her hands shaking violently. Sarah didn't look up. She kept her eyes locked on the back of Trent's head, her breathing perfectly even. "Pull that phone out, Jessica, and I will shatter his humerus," she said. Her voice wasn't raised. It was flat, conversational, and utterly terrifying. Jessica froze, her hand hovering over her pocket. She looked at Sarah, truly seeing her for the first time. The dull, lifeless triage nurse was gone. The woman kneeling on Trent's back possessed a cold, predatory stillness. Her grey eyes were flat, devoid of empathy, registering the two of them, not as colleagues, but as tactical problems to be neutralized. "Security takes 4 minutes to respond to a call in the loading dock." Sarah continued, her tone clinical. "I can dislocate his shoulder in 1 second, rupture his brachial plexus in 2, and close the distance to you in 3. You will be unconscious before the dispatcher picks up the line. Put your hands flat against the wall." Jessica whimpered, tears instantly welling, and pressed her palms flat against the dirty cinder block. Trent was hyperventilating, his cheek smeared against the cold floor. "Jenkins, please," he wheezed. "You're breaking it." "I am applying exactly enough pressure to stretch the ligaments," Sarah corrected calmly. She leaned down, bringing her mouth close to his ear. "You like anatomy, doctor. You like the power it gives you over people. Let's talk anatomy." She shifted her knee a millimeter higher on his spine. Trent choked out another gasp. You threatened to end my career, Sarah whispered. The smell of industrial ammonia mixed with the scent of Trent's expensive hair gel and raw fear. You think you hold the cards because your father bought your way into a residency. You think because I empty bedpans and don't speak I am weak. She pulled his wrist a fraction of an inch higher. The tendons groaned. I was a Special Operations Independent Duty Corpsman. I spent 6 years attached to a Navy SEAL platoon. Sarah said, her voice dropping into a dark, hollow register. The memories threatened to bleed in, but she boxed them out, using the cold facts as a weapon. I have packed chest wounds in pitch darkness while taking mortar fire. I have amputated shattered legs in the back of a shaking transport plane. I have watched better men than you bleed out in the dirt, and I kept working because panic gets people killed. Trent was trembling uncontrollably now. The sweat on his forehead mixed with the grime on the floor. You froze tonight, Sarah stating a mechanical fact. You froze because you don't know what trauma actually is. You just like the uniform. If I hadn't stepped in, you would have pierced that boy's liver, and he would have drowned in his own blood, and you would have covered it up. I wouldn't, Trent stammered. You would. Sarah cut him off, her voice devoid of judgment, simply acknowledging a grim reality. Because cowards always protect themselves first. The silence in the corridor was heavy, broken only by Trent's ragged breathing and the distant muffled hum of the hospital's HVAC system. Sarah held the joint lock for another 5 seconds, letting the reality of his total physical helplessness burn into his nervous system. She needed to break his ego completely. If she left even a splinter of his pride intact, he would retaliate through official channels, and her quiet, anonymous life would be over. I don't care about this hospital, Sarah said, her voice returning to its normal, slightly raspy volume. I don't care about your inflated ego, and I don't care about your pathetic little power trips. I care about being left alone. I endure the noise up there because it pays my rent and keeps me moving. She leaned in closer. But if you ever touch me again, if you ever threaten me again, I will not report you to HR. I will simply wait for you in the parking garage. Do you understand the difference? Yes, Trent sobbed. Yes, I understand. Please. Sarah released the pressure on his arm, but she didn't get off him immediately. She needed to lay down the final parameter. You are not going to the medical board, she dictated. You are going to go home. You are going to ice your shoulder. When you return for your next shift, you will not speak to me unless it is a direct medical necessity regarding a patient. You will not order me to clean up biohazards. You will treat the nursing staff with the exact same deference you fake for the attending surgeons. She felt Trent nod frantically against the concrete. If you fail to do this, Sarah continued, playing her final card, I will not hit you. I will simply email the file I have compiled on your surgical errors over the past 6 months to the Chief of Medicine. Trent stiffened beneath her. Invisible people see everything, Doctor, she murmured. I know about the missed deep vein thrombosis diagnosis in bed 3 last month. I know about the botched intubation you blamed on the respiratory therapist. And I know Jessica forges your initials on patient charts while you sleep in the on-call room. Jessica let out a sharp, strangled gasp from her place against the wall. I have dates, times, and photocopies of the altered charts. Sarah lied smoothly. She didn't have photocopies, but she had a photographic memory trained under extreme duress. It was enough. The bluff was impenetrable. If you cross me, I will end your career before your fellowship even begins. She finally stood up. She stepped off Trent, moving back to her duffel bag with that same gliding, silent economy of motion. She didn't dust off her knees. She didn't adjust her scrubs. Trent scrambled backward, clutching his right arm to his chest like a wounded animal. He dragged himself up against the opposite wall, his eyes wide and terrified. His designer scrubs were filthy, his hair a mess. The illusion of his authority had been entirely stripped away, revealing the frightened, insecure boy underneath. Sarah picked up the canvas strap of her bag. She looked at Jessica, whose hands were still glued to the wall mascara running down her cheeks. "Ah, find a new hobby, Jessica," Sarah said flatly. "Bullying exhausted people is a weak substitute for a personality. Do your job and stay out of my way." Without waiting for a response, Sarah turned and walked down the corridor. She pushed open the heavy metal exit doors and stepped out onto the loading dock. The cold morning air hit her face. It smelled of diesel exhaust from the idling delivery trucks and the damp, metallic scent of the city. The sky was turning a bruised, pale purple. The adrenaline was beginning to recede, leaving a familiar, hollow ache in her joints. Her bad knee throbbed. The scar tissue on her left shoulder, a parting gift from a piece of shrapnel in Kandahar, pulled tight against her cheap scrubs. She was 34, but her body had accrued the mileage of a much older woman. She walked toward the bus stop, her posture slumping back into its tired, unassuming shape. The predatory stillness vanished, packed neatly back into the dark corner of her mind, where she kept the rest of the war. She didn't feel triumphant. There was no joy in what had just happened. It was just maintenance. Another hostile environment managed, another threat neutralized. Tomorrow she would clock in at 7 p.m. She would wear oversized faded scrubs. She would log vitals, endure the fluorescent lights, and blend into the background. Dr. Trent would give her a wide berth, and the ER would continue its chaotic churn. She was Sarah Jenkins, a tired triage nurse at a miserable city hospital, and she preferred it that way. Sometimes the quietest people in the room are the ones you absolutely shouldn't push. Sarah proved that real strength doesn't need to shout. It just needs to strike when the moment demands it. Dr. Trent's ego will never recover from that concrete flaw. If you loved seeing this arrogant bully get a brutal dose of reality, hit that like button right now. Share this story with someone who loves a good karma payout, and make sure to subscribe to the channel for more incredible stories.